a month before the exam, I think it clicks. I think, okay, I think I can do it. I started taking sertraline for a good nearly 2 years now, mainly because I think it lessened, the anxiety is still there, but I suffered less. The confidence is a lot boosting as well, so I know what I was doing. I think leading up to the exam, I actually had a word with my GP as well. I looked and he gave me a few propranolol.
My guest today is a newly qualified GP, Dr. Joe. Hi Joe, how are you doing?
I'm alright, thank you very much.
Congratulations on passing your exam. How does it feel?
Yeah, feeling relaxed, so I can start being a GP now.
So tell us, for people who might not know you, a little bit about your background.
Yeah, so basically, my name is Joe. I'm from Burma, Myanmar. I've been in the UK for the last 13 and a half years now. I was a medical registrar in Cornwall, and I decided to become a GP about 4 years ago. So I came over to Swansea to do my training. So I've been in Swansea as a GP training since August 2021. So I've been in Swansea for a while now. So this is basically me. Before that, I was back in Burma. I did a few medical jobs over there. So yeah, so at the moment, a fully qualified GP now.
Yeah. So now you're fully qualified GP. Let's rewind back to when you were in training. Tell us, what challenges did you face?
So it's one of the main challenges is being a medical registrar before, and you have to consult everything one single consultation within 12 to 15 minutes. It's quite a challenging one. My first ever consultation as an ST1 was about 45 minutes, and then my trainer told me, we don't do it that way. So it was the main challenge, because as a medical registrar, as a medics, we were trying to do a very full textbook type of clocking, and you can't do that in a GP land, so you have to be quite concise but also safe as well. And this is something that I feel quite proud of, because 3 years down the line, my consultation style is a lot better. I know quite a lot about my patient within a 10 minutes time frame, which is quite it's quite challenging to begin with. So that's the main challenge. And also number two, I would say, is I used to be a GP. I used to be an FY2 in a GP practice up in North Wales, and that was about 10 years ago. And I would say the people expectation has changed a lot in the way that people. I think there's a lot of health anxiety as well. So it can be quite anxiety inducing when you first step into this role that you're not quite familiar with. So that was the main challenge. Being a medic forcefully gave me in a way that I know a lot of stuff, but that's not the stuff that the raw quality is looking for. I think what it's looking for is they don't want to know that you know everything, but do you know well enough, or do you know enough to get this consultation safely? I think that's a big challenge for me.
Yeah. So I remember when you actually got in touch, there were some issues you had with anxiety. I remember you mentioned that you were taking propranolol as well. So tell us a little bit, how was anxiety? How bad was it?
So the anxiety was quite bad in a way that I suffer from exam anxiety. I think I still have one. But I think when I was in my ST3, so I've been in ST3 for about 1.5, 2 years. And initially I was in a practice that they were quite good, but the training could have been better. So I don't think I was getting, I think I was doing okay, because I was given an okay feedback, not a lot of how should I say, constructive feedback to begin with. So I thought I was okay doing the exam. I attended a few courses before I met you, Erwin. And what happened was, they told me, okay, I think I was okay, but when I was actually do the exam per se, that one is doing what in front of the computer, a bit of unnatural, and at the back of my mind, I think I was subconsciously telling myself, I'm doing this exam rather than doing a live consultation. So it wasn't very natural. I didn't pass the exam. That was about 1.5 years ago, and I think it's more like the anxiety took me over. So what happened was, in the exam, I was thinking, oh, what should I ask? What should I ask? What should I ask next, rather than focusing on the patient itself, which is not usually the case with the real life patient, but this is something I have to get through. So I think that was the main challenges, where I was having a lot of anxiety during the exam. And essentially, understanding failing the first time around makes the second one a lot more anxiety inducing as well. And another thing personally is basically I was working in the surgery where I was more or less as a treated as a salary GP rather than as a trainee. So that was, I think that might be partly as well, but it's about the confidence to do the exam naturally, which is I'm basically compared with if you want to know, the second time around I did the exam, which is about 2-3 months ago. At the first 1 or 2 stations was I felt like a bit of anxiety inducing as well, but after about second case, it came out quite natural. So the third case, the older, and I told myself, oh, it's not too bad anymore. I basically treat it as a real life patient. I don't take it as an exam, and it just comes out quite naturally as well, like something clicked in that.
So it sounded like the anxiety has been quite difficult and it was holding you back. And also even during the exam day, you were feeling a bit anxious, but then after a couple of cases, you got in the flow. What would be the biggest thing you learned about how to manage anxiety too?
I think the first time, compared with the first time, possible that I might not have been, I don't think I have got this click, like when I was doing the exam the first time around, I thought I was okay. But the second time I do this, the more I practice, I started realizing that basically, how should I say, something clicked in myself where I think this is something what you told me as well. Like I flipped the switch because I think when I used to be anxious is if let's say if the consultation or the script is not going the way that I want to be, and then I anxious. But you told me at one point that as a GP we will be managing uncertainty. So I think I flipped the switch in me that I embrace the uncertainty, and by doing that mainly I started enjoying doing the cases a lot better. And so I was, it's more like rather than hoping for something that I know already, I was more like hoping for, okay, is that, I was hoping for something that I had no idea about, so that it makes me learn. And I started enjoying in that type of pacing where I started expecting uncertainty, is how should I embracing it. So I think that's the one thing. The second thing that I did differently is rather than trying to be perfect all the time, I think it's you and most of my trainers told me that there will never ever be a perfect consultation. Just be yourself on a good day. So I accept the fact that I will not cover everything, but I knew well enough to manage this safely. And I tried myself not to push myself too hard. I was telling myself, just be natural on a good day. That's the second thing. And the third thing is, this is something that you told me as well, where rather than try to improve every word in one go, I try to improve by, let's say, 1 to 2% or every day or every week per se. So by doing something like that, it basically gives you a bit of a checklist. Okay, this is something I'm aiming for, but it's going to be too stressful to basically do everything within one go. So one step at a time. I think improving by 1% every day or every week is something that I would strongly recommend to other people as well.
Absolutely. So then, did you feel like your confidence was building? How did you feel about your confidence then?
The confidence was building actually, yes. Initially, I was doing a lot of cases within a week, and that thing with a few of my trainers, and I think you told me as well. So rather than doing everything one go, and I can see the difference. Like for example, this week, I'm going to then say make sure that I don't forget the psychosocial bit in the data gathering one. So, and the second week around, okay, I think I'm polished this up. So I focus on another thing. So let's say about 2 months, 6 weeks down the line, I can see in my videos that even my education supervisor said, Joe, if this were to be RCU case, this is the video that I would like you to choose because it's very natural. It's a perfect consultation, good complexity, and despite the fact it is complex, you don't lose your shit, things like that. So so the confidence building was about it's slowly built up. And at one point, maybe about a month before the exam, I think it clicks where I think, okay, I think I can do it. In the way that I think I think things started to make sense. And if there are trainees out there, this is something that I would like to basically like. There will be a point where you know yourself that you're gonna pass the exam. So this is what I would say for, and
So I've noticed sometimes when trainees are a little bit anxious, they work and they put things into practice, and then there is a time when everything clicks and they see there is a possibility, and that's what you described. So tell us about the data gathering. How did you reduce your time?
Yeah, so data gathering wise, it's all in the structure that you mentioned. So data gathering wise, I switch it down to, let's say, 3 parts, like first open question, just let the patient talk. Real life, it might be a bit difficult because some people just don't stop talking, but in the exam, the actors are trained to give you a minute or two. So let them talk as much as they can, try not to interrupt. And after that, once you stop talking, then you started doing data gathering. And when it comes to data gathering, I gave this two things. One is a biomedical and the psychosocial, which is in your package as well. And in the data gathering wise, I normally pull forward the open question and the closed question. And this is where I add on the reflex at the same time as well. So, and basically I was thinking about differential flow already. And one of the things I started noticing is during the data gathering, I started formulating a plan.
Yes.
So it's quite hard initially, but the more you do this, the more it will be easier for you to start formulating a plan as you go along.
Yeah.
So it's data gathering. In the psychosocial bit, I always make sure I remember, okay, if it is, let's say, a child, make sure there is a school and home situation. If there is any work involved, just go down that route because you might be able to use the information in the management bit as well. So in the psychosocial bit, it's not just about smoking or drinking. I mean, you need to ask if it is relevant.
Yeah.
Smoking, drinking wise, it's all about how it's affecting the patient, like in impact.
Yeah.
So in the data gathering, I would say biomedical one, don't miss the reflex, and in the psychosocial one, do not miss the impact because this is what they will make filtering for.
Yeah.
Depending on impact, it gives you your interpersonal skill, and it basically how should I say, tailored your management plan as well.
Certainly.
So that's would be data gathering. And I used to be quite okay in a way that I used to be like, let's say, either 4 to 5 minutes, but in some cases about 7 minutes. But what I do is, as of late, I got myself a clock on the screen that will be a countdown anyway.
Yeah.
So round about, let's say, 5 minutes and 30 seconds, I started finishing 6 minutes on the dot. Even if I don't finish it, I just move on because there's too much markings in the management bit.
Yeah.
Round about 6 minutes, I just move on.
Right. Okay. So did you actually prime your case differently the second time you went in the exam?
Yes. So when I look at the cases, I look at, okay, if it is a young girl who has never seen a doctor before, then if it is around about, let's say, 16 or 18, then I normally think about, okay, it's likely to be a gynecological case. If it's a child, I always think, okay, this is what's happening on here. I will need to make sure that there's no safeguarding issues there. So it basically, by looking at the case, I started formulating priming a case. It may not be, I might not get it correct all the time, but it makes me think about different things that they might throw. Even if they throw something, if you practice long enough, that's fine because you just stick to the structure.
Yeah.
So that would be all right.
Okay. So you anticipated what might be coming up. And then let's talk about the management. What did you change in the management, Joe?
Management-wise, the first and the second time around, so it is about between the first and second, it's about a good 11 months I did the exam. What I did was, the first time around, I was giving options, like, because this is what most of the juniors do as well at the time, like, this is what we can do, this is what I can do for you, and this is what, and I was in a way that I was giving options, but not taking ownership. This is actually in my exam feedback as well, where this doctor doesn't seem like he knows what he's doing because he's just giving up options, but not taking ownership of the decision. So I flipped around, and what I did was on the second time I did the exam, what I did was, if it is relevant to the case, I summarize it for about 30 seconds, but making sure that I don't miss out the major part. So about 30 seconds, 45 seconds. I might not do that if it is not relevant to it, but I do that, and what I do is I do the kind of like a summary, like from what you things like, from what you tell me so far, Mr. and Mrs. something, I think this is what you have. The reason I say you that is because of these, and also say that I know that you think about this one, but I don't think this is the case. So it's a good explanation. So I think a good chunk of 1 minute is about explanation or diagnosis, and then yes, let's talk about how we could best approach you. So that's where there's a management. Now in the management, rather than giving out the options, what I did was, what I did differently is, for this type of condition, the word that I use is I think this is the best management for you because this is what is suggested. But sometimes, like I've got a patient in my exam, I think I passed the case as well. Now that was a case of a benign vertigo. Now she was a lady who can't come down. She just wanted a tablet. And so I said, look, this type of condition is something called, so I explained this one. I explained that we don't really give out this medication called Stemetil because evidence-wise, there is an exercise you could do. So I explained that initially. And then if you don't want to do it, then we talk about the medication. So it's also keeping bringing the patient back into the management.
Yeah.
Before I say something, okay, rather than say, I'm going to give you this, I'd say something like, yeah, you told me about this one. I think that's a good idea, but I think what there's as good evidence is this is better.
Yeah.
But if you want to talk about it, we can go down that route. And then I think most of the actors will say, okay, yes, it should be talked about it.
Right.
They will guide you as well. So it's about the best management at the very top. So I put that at the best management at the very top. And then maybe the second one is whatever the patient wants to do. And the third one is if they have family, if they have work, I try to incorporate into these. Like I've got a patient with a newly diagnosed COPD. He just moved over from, let's say, England to Wales. Basically, he's already been, I put him on all the inhalers and everything, but exercise-wise, I was running out of time. So what I did, well, you move over here because you got grandkids. Why don't you spend more time with them, playing with kids, do some exercises, try to bring the patient psychosocial into the management as much as you can, but make it relevant.
Yeah.
So that's what I would say.
Absolutely. So yeah, you have to make sure that the plan is applicable to that patient.
Yes.
And not just a generic plan. You need to personalize it based on the circumstance, situation. So tell us about the interpersonal skill. What did you learn about interpersonal?
Interpersonal skill-wise, funny story is I think my first time around, I think my interpersonal skill was quite okay already. Like my first time, I did a gathering in management. I was 50-50 when I was 50% pass, 50% fail. Interpersonal skill, I think I've only got one station where I got a fail, but 11 station I have a pass. Now that was the first time around. The second time around, I got more pass than fail. I even scored a few clear passes as well. Interpersonal skill remains the same. So interpersonal skill wise, I don't think I have much problem to begin with because of maybe due to my personality, I was I might came across as a person who listened to patients. So interpersonal skill, I wasn't quite worried. So what I did differently this time is, okay, I know what I want to improve on. I know what I don't need to improve on this. And so I said, okay, I'm not going to worry too much about that. But yes, at the end of the day, my personality will come out eventually. So I just need to make sure that I need to carry the marks. So it is quite a hard switch to do initially. But once you get into the rhythm of it, your personality is something, although it's good, but bear in mind that the management contains a whole lot of marking. So interpersonal skill, I don't think I have much advice, but I would say be yourself and make sure the active listening is very important because whatever they throw, if they have to throw away something twice, that means that this is a cue.
Yeah.
Because I got a young lad in the exam who mentioned, oh, my mom is worried about this twice. And I told myself, he mentioned his mom twice already, I need to get into this because if you don't pick up the second cue, they're not going to give it to you anymore. So active listening is very important as well.
Active listening is often overlooked and picking up on the cues is so important, otherwise you miss a big chunk of the consultation. Have you found the insights in this video useful so far? If so, you might be interested in SCA Blueprint. Just click the link down the description below and sign up, and you will get a teaching from me every day for the next 7 days. It looks like you had a good preparation and you were more confident. You've changed quite a lot of things. So on the day of the exam, if you actually go back to what happened, what did you do to prepare before on the day?
Prepare on the day was the first time, the first and the second time, both of them were in the afternoon. So what did I prepare? One is I don't eat too much because it's going to be in the afternoon shift, so I don't eat too much because I might have come to sleepy after that. Try not to drink any coffee because I'm anxious enough already. If you want to know, basically I'm a lot more calm already, but leading up to that, what I've been doing for myself is with the mental health, if you want to know, I started taking sertraline for a good nearly 2 years now. Mainly because I think it lessened, the anxiety is still there, but I suffered less. And plus, the confidence is a lot boosting as well. So I know what I was doing. And what I was doing is, I think leading up to the exam, I actually had a word with my GP as well. Like, look, can you get me a few propranolol? Like, I started taking 1 or 2 tablets about a good 1 month before, then just 2. And it's all about these small rituals. And I don't think 20 milligram propranolol does actually do anything for me.
Right.
But it's all about the small rituals. Like, for example, you do that. So when I'm in the morning, I do that. And every 4 cases or every 6 cases, even doing the day surgery, I make sure that I take myself a rest. Similar to how the actual exam is. Each and every exam, let's say, what I normally do is after about 2 or 3 cases, I take let's say a 10-second breathing exercise break, try to trick my brain that this is not the exam, this is the real life consultation. So I was building that particular habit and rituals, like the propranolol maybe, but the breathing exercises, make sure that I take a step back, and I do exactly the same thing in the exam as well. So that's why after about 2nd case, I felt just feels very much like a real life consultation. I started enjoying a lot more. I actually came out of the consultation room and the exam a lot happier than the first time around, because initially I was thinking I might pass, I might not pass, it's 50-50, but this time I was saying if I don't pass, I might be very unlucky, but I feel so good about that. I got this vibe that where I think I will pass. I mean, I passed nonetheless, but
Okay. So tell us, on the day of the results, what was your reaction when you look?
Reaction-wise, I think it's all about. I think the word is called positive reinforcement. Because, understandably, each and every trainee will be anxious, but like my wife, my mentor, you guys, everybody, like, Joe, we believe in you. Like, one of the things that you want me to do during the preparation was write down the positive feedbacks I got from my patients. So I was looking at that, and I told myself, well, my patients love me. My colleagues have faith in me. And I told myself, there's a reason why they like me and they have faith in me, so I should pass the exam. I was still anxious, but compared with the first time around, I think I was okay. I was not pacing around the room either. And funny story is, I didn't even, the first time I was basically look at my exam 5 p.m. on the dot. I didn't even do 5 p.m. I just basically wrote about like 5:15 or something. Just chill, try to chill a bit. So it's not because I'm confident I will pass the exam. It's all about I try to look after myself better. Because if I don't pass the exam, that's not the end of the world. But that's why. But then again, I told myself, well, I'm leading up to this already, I should pass. So that's the main thing.
That's great. And now you've got a lot of things going on. And tell us a little bit, what are your goals now?
So the first thing I'm going to do, well, what I'm currently doing is the job prospect in Wales is not very great at the moment. But that's fine, because there's a lot of locum jobs lying around. I've applied for a few salary GP jobs already, but I'm very likely to do a few more locuming for maybe a few months before I actually go in, because I need to know which surgery would be best suited for my personality. Like, speaking of which, I know which surgery I want to work, and I know which surgery I would rather not go back to. So you have to have this feel as well. Side project wise, I think when I was attending your master class a while ago, I think one of the trainees in your class told me that when he didn't pass the exam first time around, he did it. I think he ended up taking up swimming or something.
Surfing, yes.
Surfing or swimming. So that clicks in my mind that, okay, I'm going to do something that is outside my comfort zone. So I did 2 things since the first failure of the exam. I started walking the dog as a charity dog walker in Trainee, and I'm a finance geek, so I started taking up swing trading, and so this is what I ended up keep on doing. And now, since the exam is out of the way, become a GP. So at the moment, I have finished the exam. So on top of the job prospect, I'm writing a finance book, mainly for the junior doctors, coming out in end 2025. What am I doing? I'm basically taking up property investment courses, and where it's more like, what I will do is I'm going to start as an investor first, but I think what I'm going to do is I'm going to start helping the doctors, the GPs, about property investment on the long run, for a fee, of course. So that's what I'm doing. So I've got a few things going on now. This is something that I've always wanted to do, but the exam was in the way. But this is what I like about being a GP, because I don't see myself as a full-time. I'm going to do maybe about 4 to 6 sessions a week as a GP, either salary or locum, plus or minus both, and maybe 2 or 3 days I could do all the other side ventures. Whereas I like about, being in a primary care doctor as well.
That's really exciting. Now that you got that exam out of the way, you got opportunities. So for somebody who's been listening to you up until now, they're feeling like they've not passed exam, they're looking for help. What will you tell them to help them make the decision of the next step?
It will come to a point where it will click. I think most of the people will say as well that, like, you have to do more videos, practice, which is true, because the more you do it, what will happen is the more you do it, the more knowledge that you accumulate. And what will happen is, if you were to, let's say, do a case like IBS or COPD, you've done this multiple times. You know your things already. Just own it. So I think there will come a point where you click. So if you haven't passed the exam, don't lose heart, because I was never a good person at passing exam. I got severe exam anxiety, but that's why I find Erwin as well. But what I would suggest is just keep on pushing, but try not to be perfect, because try to be perfect is going to, I would say, mess up your consultation. I know Erwin, I was an ST1 because we both in Swansea. When I did the passing exam, I found him, I got calls from him. What I find very useful from Erwin is not about the knowledge, it's about the mindset behind it, like embracing the uncertainty. 1% or 2% is bad as a small step every time. And the SCA companion guide is quite standard. I really highly recommend it, because let's say, if you know something, write down. If you've done something, write down, so that, let's say, about just admit before the exam, it's quite a confidence booster as well, because you know that you have done the job, so that if basically it quite a good fit. And I find the course very useful because of mainly the mindset behind it, than the SCA companion one.
Thank you very much, Joe. It's been a pleasure to play a small part in your preparation and see now that you're on the other side.